welcome to the deep dive. Today, we're looking into something you might just dismiss as, achy legs, but it's actually a big deal for your overall circulatory health. We're talking about peripheral artery disease, or PG,
Right.
and we're specifically going to connect the dots between PA and high blood pressure. Our guide for this is Dale Ruddock's book, Lowering Blood Pressure Naturally.
Mm.
Okay, so let's unpack this idea. Imagine your body's trying to send you a message, right? Maybe it's just a little ache or, I don't know, some numbness in your legs, something you might just brush off.
Mm-hmm.
But what if that's actually a really critical warning sign? And what if it points right back to something maybe you already deal with, like high blood pressure?
It's a really interesting connection, isn't it? How something like high blood pressure, which can feel quite silent, sort of ripples out and shows up as a problem, say, in your limbs. We're looking at some pretty insightful health information today for this deep dive into peripheral artery disease, PAD for short.
Right, PAD.
And specifically why getting that blood pressure under control is just so crucial for preventing it.
Exactly.
Yeah.
So our mission here in this deep dive is to really get to grips with this link. What actually is PAD, fundamentally? Who's really at risk here? And maybe most importantly, why does managing blood pressure seems like such a powerful tool for protecting, well, your legs and your whole vascular system? Let's get into it.
Okay. So peripheral artery disease, PAD. It's basically a condition where the arteries, the pipes carrying blood away from your heart to your limbs, arms and legs, mostly they get narrowed or sometimes even blocked.
Like plumbing getting clogged up, essentially.
Pretty much, yeah. Think of it like that.
And this clogging,
Yeah,
it's usually down to that same plaque buildup we hear about with heart disease, right? Atherosclerosis.
that is spot on. Atherosclerosis, that plaque buildup, is the underlying cause. Now, here's where high blood pressure comes in, according to these sources, and it's kind of sneaky. High blood pressure doesn't just correlate with plaque building up in these peripheral arteries. It seems to actively speed it up.
Really? How does it do that?
Well, think about it. That constant extra force, high pressure pounding against the inner walls of your arteries, day in, day out, over time, it causes tiny bits of damage, microscopic damage.
To the lining, the smooth inner lining.
Exactly. It's like, well, constantly scuffing up a smooth surface. This damage creates these little rough patches, and those rough spots make it way easier for fatty stuff, cholesterol, calcium, other gunk, to kind of grab hold and start building up into plaque.
Okay, so the high pressure is almost like preparing the surface for the plaque to stick better and build up faster in those arteries out in the limbs.
That's a great way to put it. Yeah. It's
Yeah.
creating the perfect conditions for plaque to form more easily.
Makes sense. So the pressure isn't just pushing blood, it's also, roughing up the pathway for plaque.
Right.
So what happens then downstream when the blood flow actually gets reduced because of this narrowing?
Well, the most common things people notice come directly from not getting enough blood to the muscles and tissues, especially when you're active and they need more oxygen. So you might feel pain, maybe cramping, or just heavy fatigue in your legs or even your hips. Often it comes on when you walk or exercise.
And that it eases off when you stop and rest. That's claudication, right?
That's the classic sign. Claudication. Exactly. You could also notice numbness or one foot or leg feeling noticeably colder than the other.
Just because not enough warm blood is getting down there.
Precisely.
And I know from the material we looked at, the consequences can get much more serious if that blockage gets worse, can't they?
Yes, unfortunately. If the blood flow gets really severely restricted, the tissues just don't get the oxygen and nutrients they need. So they can't heal properly. This can lead to sores, often on the feet or ankles, that heal incredibly slowly, or maybe don't heal at all.
Which sounds like a recipe for infection.
It absolutely is. Those non-healing sores can easily get infected. And in the really severe advanced cases, that prolonged lack of blood flow can actually cause the tissue to die. That's gangrene.
Oh, wow.
And sometimes amputation becomes necessary just to stop the infection from spreading.
That's a very serious outcome.
Yeah.
But the sources also really hammered home a point that feels critical. PAD isn't just about your legs.
Yes. And this might be the most crucial takeaway, maybe even beyond the blood pressure link itself. Finding PD in your legs or arms is it's a huge warning sign that the same process, atherosclerosis, is likely happening elsewhere in your body.
So if the pipes to your legs are getting clogged,
then there's a much higher chance that the pipes leading to your heart and your brain are also being affected.
right. So finding PD is like your body waving a big red flag saying, hey, this plumbing issue isn't isolated. It could be affecting the really crucial systems too.
That's it, exactly. Having PD significantly bumps up your risk for having a heart attack or a stroke. Our sources really highlight this connection. It's not just about saving your legs, as important as that is. It's recognizing a system-wide vascular problem that needs urgent attention to protect your heart and brain.
Okay, given how serious that sounds, how common is PAD? Is it rare or?
Surprisingly common, actually. Globally, the estimates are over 200 million people
Well, no,
affected.
200 million.
Mhm.
That's enormous.
Yeah.
Who tends to be most at risk? Who should be most aware of this?
Well, several things increase your risk. Age is a big one. It gets much more common after age 50. Smoking is a huge risk factor, maybe the single biggest one you can actually change.
Right. Smoking's bad for arteries everywhere.
Definitely. Diabetes also seriously increases the risk. High cholesterol is another factor. And then, circling back to our main topic, high blood pressure is right up there, a major risk factor.
So high blood pressure isn't just involved in how the mechanism of plaque. It's also a key part of the WHO. It marks you as being at higher risk for getting PA in the first place.
Absolutely. It plays both roles, it contributes to the cause, and it's a major risk factor marker. And here's something really important the sources stress. A lot of people with PA, maybe even most in the early stages, have no symptoms.
No leg pain, no coldness, nothing.
Nothing obvious. You could have significant blockages developing, especially if you're not very active, and feel totally fine.
That's quite concerning.
It is, and that asymptomatic nature is why screening becomes so important. Especially if you do have those risk factors, you're over 50, you smoke or used to smoke, you have diabetes, or of course you have high blood pressure. Screening is key.
Okay, so you might not feel it developing. How is it usually picked up then? How is it diagnosed?
Well, one of the simplest ways is a test called the ankle brachial index, the ABI. It's non-invasive, pretty easy to do.
Ankle brachial index.
Yeah.
What does that involve?
A doctor or nurse just measures the blood pressure in your ankle and compares it to the blood pressure reading in your arm.
Okay. And what does that comparison tell you?
If the pressure in your ankle is significantly lower than in your arm, it suggests there's likely some kind of blockage or narrowing in the arteries somewhere between your heart and your ankle, restricting the blood flow down to your foot.
Huh. That sounds remarkably straightforward for catching something potentially serious.
It's a fantastic initial screening tool. Now, if the ABI result is abnormal, or if someone has really classic symptoms, then doctors might use imaging tests. Things like ultrasound or maybe angiography to actually get a picture of the arteries and see exactly where the blockages are and how bad they are.
Right, to get a clearer look. So once it is diagnosed, what happens then? What's the management plan look like?
The good news here, according to our sources, is that PAD often can be managed effectively. You can slow down its progression, especially if it's caught relatively early. The absolute foundation of managing it is lifestyle changes.
Makes sense. Like what specifically?
Number one, if you smoke, quitting is just essential. There's no way around that. Regular exercise is also incredibly important.
Even with leg pain?
Yes, actually. Supervised exercise programs, often involving walking, are key. It seems counterintuitive, but walking actually encourages your body to develop tiny new blood vessels, collaterals that can bypass the blockages over time. It's like your body building its own natural bypass system.
That's fascinating. A natural bypass.
Yeah.
What else? Diet.
Definitely. A heart-healthy diet, low in saturated fats, trans fats, sodium, cholesterol is crucial.
And I assume getting that blood pressure under control has got to be central to managing PAD too, right?
Yeah.
Given everything we've discussed.
Absolutely central, yes. Managing high blood pressure isn't just treating a separate condition. It's directly intervening in the process that's causing the PAD. By lowering the pressure, you reduce that ongoing damage to the artery walls, you reduce the encouragement for plaque to form that we talked about. It tackles the root cause.
Okay, so lifestyle is huge. Are medications involved too?
Often, yes. Medications like statins are commonly used to lower cholesterol levels, and antiplatelet drugs like low-dose aspirin or clopidogrel are often prescribed to make the blood less sticky and reduce the risk of clots forming on the plaque, which could cause a sudden blockage.
And for more severe cases?
If the blockages are really bad and causing severe symptoms or threatening the limb, then procedures might be needed. Things like angioplasty, where they inflate a little balloon inside the artery to open it up, maybe place a stent, or sometimes bypass surgery, creating a new route around the blockage.
It sounds like there's a range of options, but it really keeps coming back to those foundational things, lifestyle,
Yeah.
and especially getting blood pressure down.
It really, really does. And the sources we looked at really bang this drum hard. High blood pressure isn't just, one risk factor among many for PB. It's presented as a fundamental driver of the disease. And managing it, that's arguably the single most important step you can take to protect not just your peripheral arteries, but your entire vascular health.
Yeah.
And the sources also give some hope there, highlighting that blood pressure can often be managed effectively.
Sometimes even naturally, they suggest, through really committing to lifestyle changes, eating better, being active consistently. That really emphasizes a sense of control, doesn't it?
Yeah.
And I did find that detail about the author's personal story quite powerful.
Yeah.
Battling hypertension for something like 20 years
Yeah.
and managing to get off medication eventually. Through a doctor-supervised plan, of course, involving lifestyle, diet changes, even fasting methods mentioned in their book.
Exactly. It really drives home the point that while, yes, PAD is serious, and yes, high blood pressure is a major risk, taking charge of that blood pressure is possible for many people. It's a concrete goal, and achieving it has a direct impact on your risk for PAD. And let's not forget the bigger picture the sources paint. PAD isn't just about leg pain or even the risk of amputation, terrible as that is. It's that flashing red light for widespread artery disease. It significantly increases your risk for those major life-changing events like heart attacks and strokes.
So trouble in your legs could genuinely be an early warning about the health of your heart and your brain. It really is all connected.
It absolutely is. Problems out in the periphery can signal danger right at your core.
Okay, so let's try and pull this all together then. The big picture seems to be high blood pressure significantly boosts your risk for peripheral artery disease, not just statistically, but by actively helping to damage arteries and build up plaque. And then PA itself, whether you feel symptoms or not, acts as this critical warning sign about the health of your whole circulatory system, especially pointing towards risks for your heart and brain.
That's the core connection, yes. That interconnectedness is key. But the other really crucial part of the message is the potential for action. The fact that blood pressure, this major driver, is often very manageable. Through lifestyle, through medical help, it means that prevention and management of PAD are realistic goals. And controlling blood pressure is right at the heart of that effort.
Which kind of leaves us, and you listening, with this final thought to chew on. When you recognize this link, how something like high blood pressure can show up as BAD in your legs, it really highlights how interconnected your body is, doesn't it? Issues way down in your limbs could be whispering, or maybe even shouting, warnings about major risks for your heart and brain. So maybe the question to ask yourself is, what steps could you take, maybe starting today, to understand your own risks? Perhaps getting your blood pressure checked, talking to your doctor about these connections, and really trying to listen to those signals your body might be sending.